Hi, and welcome to Spinal and Epidural Anesthesia by Miranda and Hannah. So, what is it? Epidural and spinal blocks are a type of anesthesia. Anesthesia that is injected near the spinal cord and nerve root to block the pain from reaching the body, usually around the hips, legs, pelvis, and belly, etc. So, it usually blocks pain from the waist down to the toes for about 2 to 3 hours. It is often used in operations such as orthopedic surgery, which is any major operation on the legs, vascular surgery, repairs to the blood vessels on legs, and so forth. Usually, this type of anesthesia is used when the procedure or labor is too painful without any pain medications, or if you want fewer systematic side effects and a shorter recovery that you would usually have from general anesthesia. So how does it work? I'm going to talk about the epidural procedure first. First, you insert a needle and a catheter, which is a flexible tube inserted into an opening of a body cavity for removing fluid, into the space between the spinal column and the epidural space, which is an outer membrane of the spinal cord, which is located in the middle and lower back. The needle is then inserted after the area has been numbed with an anesthetic and removed after the catheter has passed through it. Anesthetic medicine is then injected into the catheter to numb the body above and below the point of injection as needed. This epidural procedure usually works well with longer procedures such as labor and delivery and surgery in the pelvis and legs. The spinal procedure is pretty similar to the epidural procedure. It has a smaller needle and it's injected into the cerebrospinal fluid that surrounds the spinal cord, but otherwise, the area where the needle would be inserted is first numbed with local anesthetics. The needle is inserted into the spinal canal and anesthetics injected. But the main difference is that the spinal procedure is usually done without the use of a catheter. Also, the medicine is usually only done once. The spinal procedure tends to work better with shorter and less complicated procedures, and is usually used for genital, urinary tract, or lower body procedures.
So the effects of these anesthesia work fairly quickly within 5 to 10 minutes, and they numb the body below the region of injection until no pain can be felt and the skin feels numb to the touch. The patient will also not be able to move his or her legs until this anesthetic wears off. The patient may also be given oxygen to improve the levels in the blood, and it is also common to have a headache after this procedure. Epidural anesthesia is often frequently performed for childbirth and to help control pain after major surgeries to the belly and chest. The epidural and spinal anesthesia is also combined with other medicines that either make you relaxed or help you relieve pain. This combination would be injected into the epidural space along with a local anesthetic. In addition, this procedure also has fewer side effects and risks than general anesthesia, as the patients tend to recover much faster, including advantages such as an earlier return to drinking and eating after surgery, less sickness and vomiting, and less risk of chest infections after surgery. But of course, there are always risks during medical procedures. In this case, the patients have to be monitored carefully because the anesthetics may affect the central nervous system, cardiovascular system, and the respiratory system, and may also significantly affect other vital functions such as blood pressure and heartbeat. A complication that is also a risk with this procedure is nerve damage, although it is fairly rare. This nerve damage may result in a temporary loss of sensation, and muscle weakness may last for a few days, possibly even weeks. And the patient is ultimately expected to make a full recovery, as permanent nerve damage is extremely rare. Other risks to the anesthesia include allergic reactions, bleeding around the spinal column, difficulty urinating, and an infection of the spine.
And here's a bibliography, so thanks for watching.